Melioidosis, a name that might sound unfamiliar to many. It might be a new word for you, but it's a term that carries significant weight in the medical community. In some parts of the world, particularly in tropical and subtropical regions, it's a very real danger that lurks in the environment. This serious infection can be deadly, causing severe illness and even death if not treated promptly, and it often goes unnoticed until it's too late, making early detection crucial. What makes melioidosis so scary? It's the fact that it can mimic other diseases, making diagnosis challenging. It often hides in plain sight, thriving in soil and water, and can infect humans and animals alike. Many people don't even know they're infected at first, as the initial symptoms can be mild or mistaken for other common illnesses. That's because the symptoms can look like a lot of other common illnesses, such as the flu or a simple infection. This silent threat is a serious public health concern, especially in areas where the disease is endemic, especially in tropical regions where it's most common, affecting thousands of people each year. Understanding melioidosis is the first step to protecting ourselves. Awareness and education are key. Early detection and treatment are key to survival. With prompt medical attention, the chances of recovery increase significantly. Melioidosis is caused by a type of bacteria called Burkholderia pseudomallei. This tiny organism lives in soil and water, often going unnoticed. It thrives in warm, moist environments, making it particularly common in certain regions. Think of places with tropical climates where the air is humid and the ground is often wet. Specifically, Southeast Asia and Northern Australia are hotspots for this bacteria. But here's the thing. Burkholderia pseudomallei is a master of disguise. It can blend into its surroundings, making it hard to detect. This bacteria can cause a wide range of symptoms, which can vary greatly from person to person. Fever, cough, skin sores, these are just a few of the possible symptoms. In more severe cases, you might even experience pneumonia or a serious bloodstream infection called septicemia. This is why melioidosis is often referred to as the great mimicker. It can look like many other diseases, making it difficult to identify. Because its symptoms are so varied, it can easily be mistaken for other illnesses. This makes it tricky to diagnose accurately and promptly. Doctors need to be extra vigilant, especially in areas where the bacteria are commonly found. Awareness and early detection are key to managing and treating melioidosis effectively. The good news is, melioidosis doesn't spread from person to person. You get it from the environment. The bacteria enter your body in a few different ways. One way is through cuts or wounds. Imagine stepping on a sharp object hidden in the soil. If that soil contains, you could be at risk. Another way is by inhaling contaminated dust or water droplets. This is more likely during activities like farming or gardening, especially when the soil is disturbed. Diagnosing melioidosis is like solving a puzzle. Each piece of information is crucial to form the complete picture. Doctors need to consider your symptoms, medical history, and potential exposure to the bacteria. This involves asking detailed questions about your recent activities, travel history, and any contact with soil or water in areas where the bacteria is known to exist. Blood tests and cultures are crucial. These tests help identify the presence of the bacteria in your bloodstream, which is essential for an accurate diagnosis. These tests can detect the presence of the bacteria, Burkholderia pseudomallei, which causes melioidosis. The laboratory analysis involves growing the bacteria from samples taken from the patient, which can take several days. Imaging scans like X-rays or CT scans can also be helpful. These scans provide a visual representation of the infection's impact on your body. These scans can show if the infection has spread to your lungs or other organs. This information is vital for determining the extent of the disease and planning the appropriate treatment. Once diagnosed, treatment needs to start immediately. The urgency is due to the aggressive nature of the bacteria, which can rapidly spread and cause severe complications. Melioidosis is treated with antibiotics. The initial phase of treatment usually involves intravenous antibiotics for at least 10 to 14 days, followed by several months of oral antibiotics to ensure the infection is fully eradicated. The type and duration of antibiotics depend on the severity of the infection. Severe cases may require longer treatment and more intensive care. Early detection is key to a successful recovery. The sooner the infection is identified and treated, the better the chances of a full recovery. The longer the infection goes untreated, the harder it is to fight. Delayed treatment can lead to severe complications, including organ failure and death. If you live in or have traveled to an area where melioidosis is common and you experience any unusual symptoms, seek medical attention right away. Early intervention can make a significant difference in the outcome. It could save your life. Timely diagnosis and treatment are essential in managing this potentially deadly infection.